Hey, Facebook, it's Reagan here with DocTalk. We are live today. Before we get started, I just want to say a big thank you to all of our healthcare workers out there. I feel like you guys do not get the credit you deserve. You guys are all amazing. You haven't given up, and it has not been easy to say the least, especially right now as all of us are fighting the second wave. We've learned so many things through this pandemic. We've been pushed to the brink of exhaustion, but you guys don't give up. You continue to rise up. And at Altus, we've realized, we're never going to waver. We're never going to give up on serving our community. And we just want to thank you guys for sticking it out with us and just as we go through this journey together. But Dr. Goffey, welcome to the show. Welcome to Doc Talk. How are you, sir?
Good afternoon, everybody.
Thank you so much for joining us today. We've been, right now we have so many questions lately with COVID related stuff. And I thought, why not now? Right now we have our huge spike going on across the U.S. So I figured this would be a great topic and discussion to talk about today.
Yeah, thanks for having me. I think it's very important. Being one of the principal physicians at Altus, naturally we're seeing a massive spike. And I think it's important that we get the community involved and kind of settle what everybody's talking about as far as the medias and variants and what to expect and how dangerous it is and how to prevent it and also how to treat it if it is too late with prevention. So
Right.
I'm happy to be here.
Awesome. Well, thanks for joining us. I have a list of questions that people have sent in and been asking on Facebook. So the first big question I get, what type of symptoms should people look out for? I mean, there's so many. What are the main things people should look for?
Yeah. Unfortunately, with COVID, it's this unique virus that if you were to put some, all on a board and you can close your eyes and throw it with a dart and it could cause it. We initially a year and a half ago, it was everything here, right? Cough, congestion, fever, headache. Then it transitioned into abdominal pain, nausea, vomiting. And now it's a combination of all of them, really. And that's kind of the tricky part about this virus is that it affects your entire body. I mean, from your head down to your toes, right? It can cause anything. So basically, I'm not saying every symptom, right? Finger pain is not necessarily it, but stick to the classics. If you got yourself a headache, runny nose, fatigue, right? Of course, shortness of breath is a big one. That usually means it's a little late from the early stages. But if you're just not feeling well, it's always important to get checked out.
Right. There's so many symptoms, but, speaking of, Virginia just said she was diagnosed this morning. She was fully vaccinated. She thought she was safe, which brings us to our next question. People want to know, if you're vaccinated, can you still get COVID?
So I think this is an important question, Virginia, and I'm glad you asked that. The vaccine was not designed as a cure. I mean, I want to make that clear that, you hear so many things. You're good if you're vaccinated. And the reality is you're good, but they don't explain what is it that you're good for, right? So you can still contract a virus. You can still contract the flu after flu. You can still contract many of those inoculated vaccines. You can still necessarily catch it, but you have the antibodies so that you start fighting it sooner. Meaning, Virginia, you might have been fully vaccinated and you say, oh my God, I got it. But I guarantee you're not going to end up in an ICU or on a vent and have serious complications. So what would normally be a full spectrum of 7, 10, 14, 2 months of feeling poorly, now is going to be some, you can feel bad. I mean, you can have a headache, you can have fever, you can have night sweats, but you're not going to need to be hospitalized. And that's really the key component. When they say you're good, that's what you're good for. You're good for the fact that you got a jumping start, right, on fighting this virus the second time you get it. And I think that's one of the biggest things we need to clear up. You're getting vaccinated to prevent serious complications from COVID, not necessarily being able to contract it.
Right. And Doc, you have a front row seat. I mean, you're in the hospital almost every day. You get to see this firsthand. I've been seeing it firsthand as well. And stepping back, looking, all those people that are vaccinated, yes, some people can still get it, but it's like a Diet Coke version, and they're not as
and that's the truth, and that's the whole point of the vaccination, right? I mean, the treatments kind of go hand in hand with that. What you do is you set yourself up for success. It's if you're lighting a campfire, you're more successful in not burning anything down if you sit next to yourself with a fire extinguisher. And that's exactly what you're getting with the vaccine. You're getting yourself the fire extinguisher of that fire, right? And it doesn't mean that you're not, going to light the fire, right? But it means that you're not going to be, in this critical component where you're needing to be intubated or on oxygen or suffering more than you would than a regular flu. And I think that's the important part. I mean, it's unfortunate that, I'm not going to say I haven't diagnosed somebody that's been vaccinated, but I will tell you that all of those people that I diagnosed were for other reasons. They came in because work needed them to get a swab because they had sniffles. Not a big component of COVID complications. Others had other issues. For instance, somebody had a gallbladder that needed to be taken out, and because they were going to surgery, we had to swab them. Absolutely no symptoms whatsoever, but they were positive, and therefore they had to take precautions with the patient. But we're talking about a gallbladder removal, right? So, the people are not coming in for the same complaints. Right now in Lumberton, we're having people from 30 and above, healthy, maybe overweight, some diabetic, some not, that they're on oxygen, and not just regular oxygen, high flow oxygen, or even that big Darth Vader BiPAP mask that, and they're on it for days needing an ICU bed.
Right.
And those people are all unvaccinated. Needless to say, the further up you go along the age bracket, the worse the outcomes are.
Right. So, Doc, I've seen a lot of infusions lately. It seems like the government, I guess, went ahead and gave the go for, is it Regeneron? Is that how you say it?
Regeneron.
Okay.
Yes.
And I've been seeing people using that a lot, doctors using a lot. How is that working out? Tell people what that is.
So, there's two components that we have right now in our repertoires as far as to treat COVID, right? We did the azithromycin, which is, the Z-Pack. I'm sure everybody's heard of it. Ivermectin that's out there. And now Regeneron, which is the antibodies, okay? Essentially, the vaccine gives you the antibodies, right, that you make them and you produce them yourself. Regeneron is almost like, okay, I got it. I didn't get vaccinated. What is it that I can do now?
Mm-hmm.
So besides the Z-Pack and the ivermectin and, of course, the steroids if you're short of breath, these antibodies kind of help. It's almost like recruiting soldiers, right? And they come into the body and they're able to attack this virus without you mounting an immune response to it. They kind of give you backup, okay? It's the easiest way to put it, but essentially it's a medication and it's like an antibody. Now, the thing about Regeneron is that the sooner you are positive, right? Meaning don't wait until you feel short of breath to come into the ER. If your spouse or your daughter that you've been around for 2 days is positive, the sooner you get that on board, right? The better it works, right, naturally, because that kind of leads us to what's going on right now. Why is this so infectious, right? All of a sudden we get this big splurge, and we're so that Delta variant that everybody's talking about. It's not to say that this virus is completely different, right? The medication still works, the vaccine still works. The issue at hand is, like anybody in a profession, if you are, if your 15-year-old son goes and becomes a grocery store bagger, right? On his first month, he may only bag, 10 bags a minute. Well, if he does the job for 2 years, what's he going to do? He's going to bag faster, right? And that's what this Delta variant does. It replicates faster. What was normally a 1 million, viral load on day 3 or day 4 is now 10, 15, 20, 30 million. So therefore you're getting sicker faster and you're getting a more severe disease because this virus got better at its job, right? So now more than ever, it's more important that if you are having, anything, or that the person that you were with for the weekend is positive, the sooner we know you're positive and the sooner we can get Regeneron in you, the better your body will fight it. And you have a better chance of the non-vaccinated individuals to be able to avoid hospitalization.
Right. And some of the friends that I've talked to and people that just told me in Lumberton that they got their Regeneron here, they told me they feel way better, already day in, day two. So it seems to be working well.
And the sooner the better, right? I mean, there's qualifications for it, right? One, you need a positive test, right? So don't get discouraged if you were with them for the weekend or that person for the weekend and you come in on Monday, you're not positive. Well, I mean, it wouldn't hurt to come in Tuesday or Wednesday before the symptoms start and get rechecked, okay? And that could be with us or that could be anywhere, naturally. because the sooner you get on it and the sooner you're asymptomatic while you get this Regeneron, especially with people who are diabetics or smokers, of course, or any autoimmune or any type of disease in general that can be affecting you, the sooner the better. Okay. And especially because, it's kind of too late to get vaccinated, right? I mean, that's if you've already been exposed. If you don't test positive for a couple of days, naturally, I would say run and get the vaccine. But essentially, you don't give the vaccine to someone who's actively going through COVID. That doesn't help.
Right. So real quick, Shannon just asked, and I'm going to say this wrong, Doc, so help me out. She wants to know if doctors are prescribing
hydroxychloroquine.
Yeah, I can never say it right.
Yeah. So, ivermectin, we are. Unfortunately, it's kind of getting a shortage, just like anything, right? I mean, there's a shortage around. I can't guarantee that every pharmacy has it now. Zinc is over the counter, which I recommend to everybody. That's also preventative. You don't have to have COVID in order to be on zinc at the moment. I'd recommend zinc now, vitamin C now. Those are all things that you can start taking now to, improve your immune response. You don't need to wait to be sick, right? Prevent defense is always the best. Hydroxychloroquine is something that I would prescribe it if that's something that they want. You don't need to double up per se on hydroxychloroquine and ivermectin. Most of the studies of ivermectin is without hydroxychloroquine. I think at the end of the day, this disease is terrible. I mentioned before to many people, I lost my aunt a month ago who was not vaccinated. It was, she was in Florida and got advice from her own family directly, not from me. And they decided to go unvaccinated. She fought the fight for 60 days in the ICU and ended up passing away. And I'm confident that wouldn't have happened if she was vaccinated. If a person really wants hydroxychloroquine and ivermectin, most of our doctors there are not against it. We would write it. Normally, we've been prescribing, of course, Regeneron if you don't need oxygen, because that's one of the requirements is you have to have a positive test and you can't need oxygen. But normally we'd give Regeneron, ivermectin, prednisone, which I would tell you I don't need you to come back to get it, right? But a lot of people will come in early enough that they're not short of breath. So you don't want, that's kind of like a lifeline if you do become short of breath. So you don't want to jump on a medication without necessarily needing it. So I'll tell you, hey, hold off on the prednisone until you become short of breath and then you can start taking it. But you already have that at home.
Right.
Last thing you need to do is be uncomfortable going somewhere. An inhaler, right? An aspirin, full dose aspirin every day. And I always recommend zinc and vitamin C.
So, Doc, Kimberly just asked, what are the side effects, if any, of Regeneron? Is there any side effects people have with this?
Absolutely. Listen, Regeneron, just like anything, when it went through a study, people had side effects to it. I mean, at the end of the day, if you buy an aspirin bottle, there's a packet attached to it for a reason, right? Because over the course of time in the years, they found different side effects. And Regeneron itself, we have not had a single side effect at Altus. Most of them happen within 1 hour of infusion. Actually, from the studies, they say 99% of them happen within 1 hour, which is why after you get it, we watch you for that hour just to make sure. Normally, like anything, there could be a reaction at the site, whether it's through the IV or it's sub-Q. We inject either 4 locations around the belly or the thigh, or it could be through the IV. So it's given either way. Those are the 2 different modalities to give it. And you can have a reaction at the site, but an allergic reaction to anything. So if you don't know you're allergic to something until it happens, we wouldn't know either. But of course, since you're there, we counteract it with a medication like a steroid or whatever's needed in order to correct it. Right. But they usually happen within the hour. And so far we haven't seen any, and it's not like they're seeing much nationwide, but anybody can have an allergy to anything.
So real quick, Doc, Amanda wants to know, why does COVID cause blood clots? Is there a simple answer for that? Why it causes blood clots in people?
There's a lot of things COVID is causing that we kind of don't really understand. Okay. From early on, when, this first happened, there's a lot of deaths in Louisiana. Okay. And the reason for that is when you do a blood panel, you started to see a lot of what's called liver enzymes, but those are also acute phase reactant proteins that get released into the blood. Okay. And one of those is called the D dimer, right? And these individuals, being from Louisiana, the undiagnosed hypertension, usually young, it was an African-American population, and therefore they were doing these CT scans with contrast. So they were, already dehydrated patients, long-standing hypertension, all these comorbidities that we just didn't know initially because they were young patients, 35, 40 years old. And, with the contrast, you kind of threw them into a bigger problem with their kidney status, right? So they were sick, they were dehydrated, and then you threw this contrast to see if there was a blood clot, because those are the enzymes that are elevated in a blood clot. And usually there wasn't a blood clot that early in the disease process. But since it causes your blood to be thicker, right, and you're moving less, that's obviously a recipe for a blood clot, okay? And that's kind of why we're not really seeing blood clots on day 1, 2, or 3. And I would write normally for a month of aspirin, because we're seeing it on day 10, 12, 15, 16, in that time frame where, I mean, if anybody who's had COVID, like I had, for 3 days, I didn't get out of bed. I mean, you don't move. You really feel terrible. And I am a young triathlon, athlete. And for 3 days, I was miserable. It was like the bed was soaking wet.
I remember.
Yeah, I remember talking to you. It was absolutely miserable. It was hard to drink water, the headaches, the migraines, the body aches.
I was so weak. I could barely get out. And I'm hyper. I could barely get to the restroom or get up to go to the bathroom.
Yeah.
I couldn't move.
I remember after waking up, soaking wet. We had to switch beds, my wife and I, and luckily my kids were with my grandmother, their grandmother. And luckily when we caught it, we were able to not, give it to them. And I went to go take a shower, and I went to go get water, a cup of water, and I just put on fresh clothes. And I remember putting the water cup on the fridge to get water. And my wife touches my back and says, how you feeling, honey? And it felt like I was in the Caribbean, those showers that you pull the chain and it's like a big plate. And all of a sudden I was just soaking wet again from the fever and just drenched in sweat, basically from the fevers. It took me weeks and weeks to feel, kind of 100%. Took me weeks to get running again, like I normally do.
I remember I don't want it again. I can tell you that. Yeah. I remember I do not want to get it again.
No, it was not, it's not fun. And this is a very I'm a healthy, young, physician, active, that's what I got. Right. And since then I've been vaccinated, and guys, I see 60, 70 patients a day, and I wear the mask in a room, and, and the mask, we can get into that if you guys want to get into that. But it's protected me thus far, a year solid of seeing, a large percentage of patients with COVID in a small, tiny room, right? I mean, and it's protected me. It's protected myself and my family. And I guess there's a lot more questions we can get into more.
Yeah. But somebody just asked another question. But before I talk about this, I just want to say I do believe that you have a freedom of choice. And I don't want you to think that we're trying to push fear on you when we ask this question that somebody just sent in. So I totally believe it's your choice. But somebody just asked, what is the risks of not being vaccinated, Doc? What's those risks?
So, all right. Here is real doc talk with me, in my opinion. Okay. There's too much information kind of out there. And I think the one thing to remember is that research taken incorrectly. So, if you look down, when you scroll down, you see it's just the wording that people can use is very dramatic, right?
Right.
And, sometimes people will be quoting you a study, and if you read the fine print, the study was 5 people, and therefore one person got it, and that's 25%. But that's not a real study, okay? Now, there's some things out there with children, right? Children, really, they're not problematic. Right? They're not. They haven't been suffering much from COVID. Yeah, they can feel it, but not necessarily a big problem. So I'll walk up with the ages. I have a 13-year-old son, and I know that he got COVID because I've got COVID multiple times, right? And he got it once. He wasn't feeling well, but it was 2 days, and he was okay. Now, the vaccine question for my child, right? I know that he's had it. He's had antibodies. He tested positive. And we're all going to face a decision when they're going back to school. Is he's going to have a scarlet letter if he doesn't get vaccinated, or if he does, right? I don't think my kid needs it. They're not a high risk. There is associated, there's some studies out there that say myocarditis for children. I'm not in a rush to do that for my child, knowing that he handled it just fine the first time. But he's not 65. He's 13, right? Now, I don't want him to get bullied at school because he's not vaccinated, right? Or because we just don't know what the school system's going to do, right? Are they going to separate them? I think I would vaccinate him if we needed to, if the studies came out a little better, but everything's kind of premature in the under 18, I think, at this point, okay? 20 and up, if you're not, if you're deciding against it or for it, you're young, you're going to be miserable, you should be okay, right? I mean, if you're really that anti-vaccine, you start to get into smokers, you started to get into people like 30 and above, and you have diabetes. Guys, this variant is very highly infectious. And if you have any comorbidity and you're over the age of 30, I highly recommend it, okay? Mm-hmm. This is not preliminary data anymore. This is not the original study of 75,000. We are talking about just in the United States, over 250 million people have gotten the vaccine. Worldwide, over 500 million people have gotten the vaccine. That's a study in itself.
Right.
This is not the original 75,000. Okay. If you have comorbidities, it is a good idea to get vaccinated. Okay. I can understand the fear of a 20-year-old wanting to get pregnant. I do, especially because they talk about the infertility.
Right.
And I understand your fear. I mean, it is approved by the gynecologist and OB, safe during pregnancy and before. My theory is if you react to a killed version of the virus to cause complications, you would react significantly worse to the live virus. And that's how I feel about it. If you're going to get that sick off a small little tiny dose of a killed vaccine, you're probably going to react significantly worse to 1,000% more infectious Delta variant than you would to a vaccine. You're not going to respond to the polyethylene glycol. I mean, you're an adult, right? I know there's a lot with that before with, the MMR vaccines, but at the age that we're talking about, those are just not issues that we're going to see as adults. It's just, you're not going to see any of those.
Right. And Doc, a lot of people out there, I mean, I've been looking through some of the comments, some people still don't want or don't believe COVID is real, and that's fine. You have your opinion, but you can't deny the deaths. I mean, you're living it, you're seeing it, stuff. It's really happening. We have a front row seat. So it is scary. I mean, this, like
the impact of COVID, it goes beyond COVID. I say to the young individuals that may only spend one day in the hospital. Okay. Right. The aspect of spending one day in the hospital has a significant trickle effect. Okay. That means that there's one less bed for something else. Mm-hmm. We're talking about at capacity locations where I have one of my best friends is a vascular surgeon, and he cannot get patients to save people from losing their leg from ischemic limbs because there's no beds to bring them for this procedure for people with, clots, not necessarily COVID related, by the way. Countless people cannot get into MD Anderson for treatment for chemo or radiation therapy because we're taking up these beds, right? Exactly. That these people will normally have. So, vaccination, I'm not going to say it's your duty to society or anything like that. But, when the normal hospitalizations average 2 to 3 days, now they're becoming 14 to 18 days.
Yeah.
Guys, we can't fly people to Colorado because there's no beds from here to Colorado.
And Doc, I don't think that people watching understand. I mean, we have people on the phone for days trying to get these patients out. Where the hospitals, not just here but everywhere, are busting at the seam because they're full everywhere. I mean, it's hard to find oxygen tanks to keep.
It's hard to find, and remember, you have staff people, right? So that's the other thing. If you're not vaccinated, it'll take you 10 to 14 days to get better, right?
Right.
Well, some of those people that get it are nurses. Some of those guys are doctors. So there's a nurse shortage. There's a doctor shortage. The tech, the front desk, all of those are staff needed to run a hospital. And if they're not vaccinated, if you're in the healthcare industry or around people in the healthcare industry, that's what's happening. And that's why there's a major shortage. There's hospitals that have beds, but they can't staff them.
Right. And like you were saying, the ones that are available, you're having to fly states away,
Yeah,
Colorado. I mean, wherever you can find
yeah,
a bed
yeah.
available.
And it's hard. I mean, even the EMS, normally they run 20, 30 minutes out. Sometimes you're waiting 8 to 12 hours for an ambulance to be
Yeah.
available.
Yeah. And all those pictures I see people posting, the ambulances are lined up. They can't find a bed, so they're outside in
Right.
the ambulance just
Yeah, they
waiting.
can't drop you off. So therefore you have an ambulance waiting 8 hours or 9 hours for a patient to get into the emergency room.
So I'll say this, I was on the fence as well. I wanted to look at the facts and, all the data. I decided to go ahead and get the vaccine. I thought it was best for me and my family because, I see the comments, but what if we get sick for a little bit? I would rather be sick for 24 hours, maybe 48 hours with a fever, a little bit of aches than to, be sick for days, suffering with maybe even worse conditions,
I had COVID. I
Um,
had COVID more than once. There was a theory being O negative. I'm O negative blood. There was a theory that we didn't make antibodies well. I got it. I got it the first time, which was miserable. Got it the second time. It was about 2 days. Didn't feel great, but got over it in 2 days. Got the vaccine. First shot, no big deal. Second shot, got a pretty decent migraine. Didn't feel good, and it was basically when I woke up the
yeah.
next day, it was gone.
But that's way
Okay?
better than having horrible hospitalization. If you can find a bed, that's way better than being in the
That's way
hospital.
better than having to go to a funeral like I had to go for my aunt. That's for
Yeah.
sure.
And I'll say this,
And
Doc.
again, this is I don't mean this. I mean it with all due respect to everybody out there with their decision to to vaccinate or not vaccinate.
Yeah.
I respect everybody. That's why I moved to this country from Argentina. The freedom of choice, freedom. That's why I served in the
Exactly.
United States Navy. I mean, I believe in that, and I respect you guys' decision.
Hey, and thank you for your service, Doc. I appreciate it.
But that's something that you have to take into consideration. If you do have comorbidities, COVID is very real.
Yeah.
It's very real. It is real.
And
It
this
is-
time,
it
and
is
this
deadly.
time around, Doc, it's so much more real. The first wave, when it hit, I didn't really have anybody that was passing away. Now it's left and right. Oh, I know them. They're my cousin,
Yeah.
my cousin's friend, my family friend. Here in Lumberton, we just lost an amazing lady who worked at Woodcrest Mother's Day Out. She took care of my daughter. I mean, I can't believe it. We just said goodbye at summer. She took care of my daughter at Mother's Day Out. She just passed away. I mean, 45 years old, just horrible. I mean, it's hitting home.
Terrible story.
It's becoming so much more real now. Just like you said, your family, it's all around us now. I mean, everywhere I look, somebody in Beaumont, somebody in Nederland. It's horrible. It's horrible.
It's not getting better anytime soon. I'm telling you, what I'm seeing this time is different than what I saw a year ago. And one of the other things that people are doing, you have parents that are 55 and they're diabetics, and it's like, oh, my daughter got it. Well, yeah, but you're not 20.
Yeah, my mom's diabetic. She has no spleen, so she's immunocompromised.
Yeah.
She went ahead and had the Moderna shot. She has, the age against her being diabetic, and of course, no spleen. So I think it was the best choice for her because I don't want to see her dying on a ventilator like I've been seeing other people.
It's not fun,
Yeah.
And I will tell you something. I flew to Florida. Okay, I flew to Florida because I, of course, wanted to be there for my aunt. I wanted to be there for my family, and I wanted to be there for my aunt. And for 10 days, every day, I went to the lobby of that hospital. And for 10 days, I was denied every single day for 12 straight hours that I sat in that lobby to go see my aunt. Okay? The only thing I could do is that they would put us on a family, little screen thing like a Zoom. And that's the only way that I was able to see her.
Can you imagine people watching this? I mean, can you imagine having to say goodbye to your loved one if they're even coherent, being able to have to do it over Zoom? They may not even be coherent if they're on a ventilator, but I mean, can you imagine having to say goodbye without being able to touch or hug your loved one? I mean, I can't imagine.
And, and that's unfortunately what happens when you get this disease and it's serious. It's hard to recover. You are alone for multiple days. You have this mask on you that just severe anxiety because you can't breathe, and you're like that for weeks at a time. You can be like that for weeks at a time.
Imagine your child or somebody not being able to be with your child. I mean, mentally they don't know what's going on.
And by the way, even if they're in there and they need just a little bit of oxygen, you're still not going to be able to be next to them because most of the hospitals are not allowing visitors.
And you're a doctor, and they still won't let you in.
And they won't let you in. It doesn't matter if you're vaccinated, not vaccinated. All of that is guys, it's a huge risk, and there's so much out there. And unfortunately, we forget the big picture, right? It's like mask mandate versus no mask mandate. And then there's research that says it works and it doesn't work. I mean, let's use a little bit of common sense. If you're walking around and people are far away from you and you don't want to wear a mask and you're vaccinated, I agree, your risk is low. But you're going to a sporting event, you're going to a place, you think just because you're vaccinated and there's a person right next to you on a plane, if he's coughing and he's positive with COVID, that you think you're 100% safe? No, I mean, that's not the case. I mean, and that's why I get, it really is upsetting a little bit when they're like, it's all or nothing with the mask. It's not all or nothing. It's common sense.
Right.
My parents are going on a cruise September 25th and they're vaccinated. Yes, I expect my parents, when they're not sitting down somewhere and they're going and it's a buffet line and they're all over. Yeah, probably a good idea to wear a mask.
Yeah, right.
You know, people are walking right by you.
Yeah.
You can walk. That's a much higher load.
Yeah.
Right?
I don't know. I don't know the science of what the mask does 100%, but if it does a little bit for me, I'm gonna wear it. In those situations. Right. I mean, if it helps a little bit, I'm gonna do it. It may help you. It may help me.
And that's kind of the issue that we're having with the media. It's like the extreme. It's like no vaccine, because I'm anti the mandate, and it's like, okay, hold on, I agree. Like, it's not, you can't mandate, make people do something, but at the same time, we can't erase saying the benefits for the people that it's beneficial to get the vaccine.
Yeah, right.
And this is real talk. This is not just throwing numbers at you guys. There are statistics, plenty of statistics out there that you'll see that people who are vaccinated are making up 0.0001% of the hospitalizations in the ICU, and the seriousness of this, Delta variant. Right? It does not mean that they're not getting infected. They just make up 0.001% of the deaths, right? It's just non-existent in the vaccinated crowd. All right. Now, and that's a true fact, right? Yeah. So are there side effects? There can be. But my theory is if you react to that vaccine, you're going to react worse to the virus.
Yeah. Right, exactly. Sandra just asked, what if you don't have the vaccine, but you want to get the infusion? Can that help you if you have no vaccine?
Well, and I mean, like I said, I mean, if you're around somebody and you're positive, they were positive, you need to come in as soon as possible, because the second that you test positive, the FDA has allowed me to use Regeneron for you. Absolutely. Yeah. But you can't just get Regeneron unless you have to be positive.
Right.
You can't,
right.
It's not a preventative.
Gotcha.
That doesn't, those antibodies act in the moment. They don't stay in your body.
So I've seen this multiple times in the comment section. William asked it and Chris has asked it.
Sure.
So I don't work at the FDA. I can't give you, exact numbers or why they're not doing this. I think it's been partially approved, and I think they said they're about to.
The vaccine or Regeneron?
The vaccine. They're wanting to know why the vaccine.
The vaccine, I believe Pfizer, there was talk yesterday that it was imminent, that it was going to happen.
Right. That's what I heard, that it was on the brink.
So guys, the FDA, I mean, turn us in the hair. It's always years to get approval for things. Okay. I can't speak as for why they haven't done it. It is emergency use FDA approved. Let's be clear on that. Right. So it has been approved by the FDA for usage. What it hasn't been is just full clearance for FDA. Full clearance, would mean that any age can get it on a vaccine schedule. That hasn't been determined, right? They haven't determined 12 to 18. So all the guidelines are not out there, and that's what it takes to get FDA approved, right?
Right.
So that's why it isn't. Yeah, exactly. Amanda's a perfect. People talk about FDA like it's important. Well, if you've ever been to GNC or you've ever been to Walmart, none of those are FDA products.
Yeah, exactly.
Okay? All the protein you take, the melatonin you take. Right. So FDA is a regulatory that basically mandates that what you're getting is what you're getting. Right. So a good example of that is you can buy melatonin over the counter. Right. And it's not FDA approved. Right. So if it says 5 milligrams, there's no guarantee there's 5 milligrams there. Right. There isn't. It's a bulk average, but it can be off. It can be 100% more, 100% less.
But William and Chris,
a standard quality, really, what the FDA produces. Right.
Yeah.
And I think that's important to recognize that, all of a sudden everybody cares about FDA, but, all the things that you take that are over the counter are not.
They're not FDA approved. But yeah, just like Doc said, William, Chris, I think they said yesterday on the news, they're very close to officially, not just
Yeah.
emergency approving it, but officially approving
Yeah,
it.
emergency has been approved since we got it. That's why they released it. That's why the government actually is making the stipend. That's why the vaccine is free, right?
Yeah.
You know, and Brenda, I am trying to keep it as simple. I think everybody throws facts on the news, and I just don't think they're relative. I think we need to. I think the community needs to understand it for what it is. Okay.
Yeah, we don't work for the government. We're just trying to give you real talk. You know, we're not trying to push fear on you. We want you to have the best knowledge possible so you can make the best decision for you and your family.
Yeah, and like I said, I mean, you know, remember, guys, it's like when, you know, my parents, right? You know, my parents need to get the vaccine, all right? And just because I'm vaccinated, right, or not vaccinated, won't stop me from getting it to my parents. You need to understand that. We can still be a carrier and asymptomatic. And that's why when you ask the question about the 20-year-old, right, the healthy, it's to prevent the seriousness of the disease for those that could have the complication of death or intubation. It's not foolproof,
right.
Everybody. Okay, this is not like, oh, I'm cured, I'm done. You know, mask mandates terrible. I'm immune. No, we're not. But what we're doing is we're allowing people to not be in the ICU and our parents not to have the severe disease, or even ourselves, by the way, you know, and be able to absorb if our kids carry it, but they're asymptomatic, right? That's what this vaccine is for, right? And I think it's getting lost in the information that you're hearing in the news because they're not mentioning it that way. It's like, oh yeah, I'm good. You know, I don't need a mask. I'm great. I don't know. I mean, if there's 100 people around me that I don't know in a convention center, I'm going to wear a mask. Right. But I don't feel like wearing one at a grocery store. I'll give you that.
Yeah. So, you know, you get the vaccine, right, guys? Let's say you're on the, you're thinking about getting the vaccine. You get the vaccine, but you're still worried about getting it. Well, just like he said, if you get the vaccine and you can still get COVID, which let's say you do get COVID. I mean, a small ache, maybe a little bit small fever for maybe a day, maybe two, is way better than being on a ventilator dying. I mean,
just from my friends that are all over Houston, emergency and surgeons and everything, I will tell you that almost everybody who's been vaccinated, the reason why they're getting diagnosed in an ER is because their job asked them to go get checked in order to come back, or they're having an elective surgery and they really don't feel anything, or they just didn't feel well. They're kind of coming in for fluids or just saying, you know, I'm curious if I have it or not. None of them are coming in for serious disease. It's just not happening. It's not happening anywhere. I haven't had a single friend say that.
So, Doc, you see this question? She wants to know, she's already had COVID. She's asymptomatic, just like you were talking a while ago about being asymptomatic. Yeah. She's tested positive for the antibody. Is it necessary to be vaccinated?
So they do recommend after 90 days. And here's something to remember, okay? And this has been on the back burner. When this first vaccines came out, you know, everybody talked about how long this is going to last. And everybody mentioned, you know, in about a year, we're going to have to reassess. Right. And most of us are at 9 months, right? The early vaccinators are at 9 months. Okay. So, you know, when you test for antibodies, this is the unfortunate part because everything is so new. It's not like hepatitis B. You have hepatitis B, right? Vaccine, right? And you could say, hey, I'm going to a place where hepatitis B is, you know, very prevalent. Okay. I can do titers. And I know that for you to be immune, right, to not have an issue, you need 500 million. And we do a titer and we say, hey, you have 500 million. Unfortunately, right now, the test for the antibodies is either positive or negative. Is that 1 million? Is that 5 million?
I don't know.
Is that 50 million? I don't know. Okay. So I guarantee you, and this is not to scare the community, I guarantee you that within this year, there's already going to be talk about getting a booster. That's going to happen. Just mark my words. It's going to happen. All right. Because you can't guarantee, right, that you made enough forever. This is a new type of vaccine. It's an mRNA vaccine, right? So, you know, we can't measure it that well. So that talk is going to come back. It's been, you know, pushed aside a little bit because people aren't vaccinated. So they're pushed more for vaccination versus everything else. But the reality is that we don't know how long they last. So if you got it, it's recommended after 90 days to get it. I say at the end of the day, you know, if you're playing video games and you got this power bar and it could be coming down, why not bring it back up to 100?
Right.
You know, with the, with the vaccine.
Right.
I mean,
exactly.
I see no reason why, you know, to be against that.
Right.
You know,
And that's the whole reason I went ahead and got it, Doc, because it showed
Right.
that it showed that I had antibodies a week or two ago. I got it in December. It still shows that I have antibodies, but like he told me, you don't know if you have 1, 2, 3,
Or
and
5 million.
I
You
want
just
to
don't know.
level up. So
Right. So I leveled, same as you. I mean, I leveled up after getting it, and I recommend it. Okay.
okay.
Don't rush after it. You finally just got over it. No, I mean, wait the 90 days.
I'll get the second Moderna dose here and at the end of August to get my last dose. So
And don't get discouraged if your arm hurts and you get a headache. Don't get
hey,
discouraged. You're
I'm not
building
gonna
that
lie.
power meter.
It felt like I was beat with a bat on my arm. I'm not gonna
Yeah.
lie, but
Well,
it
get a
wasn't.
tetanus shot. If you remember a tetanus shot, those
Yeah.
don't feel good either.
Yeah. So Obi just asked, some people are asking about getting the pneumonia vaccine instead, since it is what's putting people on vents.
Okay.
You got any thoughts on that?
So be careful with the word pneumonia. That's very generic because there's bacterial pneumonia versus viral pneumonia. COVID is a viral pneumonia. So you can get 10 of the Pneumovax vaccines and it will not help you for COVID.
Mm-hmm.
The pneumonia is, instead of being lobar or, like a bacterial pneumonia will kind of concentrate in an area and grow. This one is patchy and all over all the lungs. And that's the part that you need to understand why the symptoms are bad. It doesn't affect one little part of the lung like a bacterial pneumonia. Your entire lung pathology all over is just with COVID. It spreads differently. It spreads all throughout the lungs. So, so essentially, you can get a bacterial vaccine and you can get 20 of them. It's not going to help you with COVID.
Okay. So thanks for talking, Virginia. It says, get the vaccine. Maybe you will, let's see, maybe have a lesser case. That's right.
Yeah.
I'm hoping for myself. Yeah, I hope so.
I mean, some things are just not worth arguing, right? I mean, it's like you have 50-50 that are against, masks for kids at school. And it's like, guys, if it means my kid gets to go to school and they have to wear 2 masks, then my kid's going to wear 2 masks. I mean, I want my kid in school, right? I mean, I think you forget the big picture when you argue about this little small component of this, right? I mean, who can argue that if that's what it takes to have my kids being social with their friends, being able to play sports, being able to go out there. And yes, I know if you wear the mask, the CO2, you're right. I mean, they should be able to kind of open it up a little bit, especially if they're sitting in their desk, right? But if they're walking around the hallway and they need to wear a mask, I want my kid in school.
Yeah.
I want my kid in school.
And not only that, the mental component, after watching the kids on lockdown for a year, mentally, there was depression, suicide rates went up. And what about the kids that live in abused homes? I mean, they need to be in school,
Exactly. Well, I mean, listen, the mental component after this, everybody, this is one thing that I'd speak from the heart. When COVID messes with your head and it messes with, even if you get it or not. Okay, the depression in this country is real. The depression associated with not being by your loved ones is real. Mental health is very real as well. That's associated with this. Please open up and talk to your friends, talk to your family, because being isolated is not easy for anybody. If you have somebody who does isolate themselves out of fear, talk to them as well. We don't need to tell them what they need to do, but just know that they're loved in the world, because this has really been a big number on a lot of people mentally. Okay. Right. And a lot of families that you don't even know how they've been affected. Okay. I'm talking about that cancer patient that can't get treatment, that may not be public, of why they're sad, right? Because people keep that at home. But it's true what's going on in the world, and you need to be aware of the surroundings. Guys, take care of the community, take care of yourself, and just be friendly, okay? Like there's a lot more to COVID than just a disease. There's the depression, there's the isolation, there's, I mean, people used to get grocery help from other people, and now they won't come close to them. Those are all real problems that you may not see directly in your circle, but they exist.
Right, exactly. And Doc, talking about the variants, the Delta variant, that's the variant going on right now. Somebody wants to know, what's the difference between this one and the original COVID? I think you talked about it a little bit earlier.
Yeah, it's essentially, like I said, the medications still work. It just became more effective. It doesn't, the molecular structure didn't change dramatically where all of a sudden the meds don't work. But it just got better. So it found ways when it attaches to a cell to get in faster, so you don't create an immune response. Once it's in there, instead of 1,000 per minute, it's 10,000 per minute. So it's running faster and more efficient, just like anybody who's been doing the job longer.
And
that's the major difference between them.
And I was looking at just some of the data that we have before we had this conversation today. It says that this variant, the Delta variant, has caused cases in the U.S. to rise up to 300%.
Yeah, absolutely. I mean, guys, it's nationwide. It's not Texas. It's not here. It's not there. It's all over.
It says the Delta variant, they are learning, is 60% more transmissible. I mean, it can, like you said, it can transfer 60% more easily.
Well, and that's logical, guys. And that's what I'm saying. Sometimes erase the number. If it's better at its job and you have a higher load of the virus and you cough that viral load, you used to cough 1 million. Now you're coughing 6 million. I mean, that's common sense, right? You know, the numbers are going to follow common sense because that's the reality. So yeah, we could say the number is 60%, just like the 0.001 versus 99. I think it's over 98% of hospitalized cases from what I saw a week ago or something. It was 98.2 are unvaccinated, right? I mean, that's logical, right? What I'm telling you, if it infects you faster and you have zero defenses, who's going to go to the hospital?
Yeah,
unvaccinated.
And in the beginning, when we had this Delta variant, or they were talking about the Delta variant, I'll be honest, I wasn't sure, if I believed it or not. But sitting front row and center, it's infecting 8 to 9. If you have COVID with the Delta variant, you're infecting 8 to 9 people, and you don't even know it. I mean, it's just crazy.
That was actually very interesting. They said that was a very interesting analogy, that this one almost as infectious as chickenpox, which one child infects 8 out of 10, 8 out of 10 people. Which, if anybody who's had kids in school, you know that it's rampant. But put that into perspective to your loved ones, as adults, right? I mean, none of us remember chickenpox as that bad because we were that young, right? But this is not affecting you that young. This is affecting, your mom, your grandmother, your father, yourself, right? And, your 25-year-old boy, 30-year-old, daughter. I mean, it's there, it's everywhere. And the more infectious the virus becomes, right, by viral replication, naturally that one cough is going to let out more because there's more of it in your body.
Right.
And that's why I say the mask is very relative. I mean, if someone's coughing and you see it, and I know we've all seen that guy do it, we've all seen that person do it in public. Okay. The guy coughs and you see that, right? Well, if you're wearing a mask, the theory is like, oh, well, it can get in your eyes or something. Well, it's like, yeah, well, I wear glasses. So therefore I got a little bit of a double stoppage, right?
Right.
So it's kind of complicated to absorb, all the information. But the mask, essentially, if you see that cough, it's going to stop it. It is. It's going to stop it. Is it 100%? No. But, nothing's 100%.
Better than nothing. I mean, David just said the numbers are exaggerated as the first go round. Lies. David, you're free to your opinion, but as I sit in the hospital right now, I'm in the hospital. Dr. Goffey works every day. Like we said earlier, it takes days sometimes to find a hospital bed. I mean, you just can't deny that all these hospital beds are full. Oxygen is low. Ambulances are parked on the streets. Can't even get a room.
Listen, when I look at my board, we have a board. Naturally, we have an electronic medical, kind of record, and it used to be, abdominal pain, shortness of breath, COVID-like symptoms, right? And then, left wrist pain, right wrist pain, leg pain, abdominal pain, nausea. The last 3 days, I don't remember looking at a board where it wasn't all COVID symptoms.
Yeah, like it's busting COVID, at the seam.
COVID. And I'm telling you, I respect everybody's perspective,
right?
And if you don't like the word COVID, let's call it an upper respiratory virus.
Right.
That's fine with me. It happens to pop positive for the COVID test we have. But I think it's important to remember that people are having breathing problems.
Right.
It's everybody.
Erasing
the name, the reality is that people are having breathing problems, and the tests that we have are showing that it's this particular thing.
Yeah. And it's not just the hospitals. The urgent cares are slammed.
Oh, yeah.
I mean, 100 patients a day. I mean, the urgent cares around here, I've heard from multiple people, they'll call they say they can't take anybody else. I mean, they're at max load, max capacity. So to all the nurses, you know, and other doctors working, the front desk staff, all the x-ray techs, everybody. I mean, I just want to say thank you to the medical staff, because I know you guys are tired. I know you guys are exhausted, but you can't, you know, deny that something is going on. Whatever you want to call it, David, I respect your opinion, whatever you want to call it, but something is going on, upper respiratory, like Dr. Goffey said, and it's affecting the hospitals, the urgent cares everywhere. It's just
There is
unbelievable.
no way, unfortunately, that this won't touch everybody who's here, even you, David. It's gonna touch you one way or another. And I don't mean that you're gonna be infected, and God forbid, I hope and pray you don't.
Hope you don't. I hope you don't.
But I guarantee you that you're gonna know somebody that's gonna go through it before the next 6 months is up. And it's unfortunate. It's unfortunate for anybody. I don't wish it upon anybody. So, you know, and that's why I respect, you know, and that's why I barely want to talk to you guys about numbers. I want to talk to you about the reality. My ER is full, and every ER in the state of Texas is full. Every ER in New Mexico and Arkansas is full with people short of breath, needing oxygen, needing medications. And that's the truth.
Yeah. And Dr. Goffey doesn't have
numbers don't matter. What matters is what I can see. Right. And those are numbers in themselves for sure, but it's going to touch you one way or another. And I hope and pray it doesn't, but it's more than likely, unfortunately, because of the way it's happening, that it's going to happen. And you know, and I wish them well, and I wish you well.
Yeah. Dr. Goffey doesn't have anything to gain. I don't have anything to gain. We are just, this is the lens and the scope that we sit in and we see every day. We see it happening. We don't get money from the government if you get a vaccine or anything. We just care about you guys. And that's why we want to have this real talk with you guys, so you can be aware and make the best decision for yourself. But, you know, as of late, all the people that I've talked to that didn't get the vaccine told me they're very regretful that they didn't take the shot when they had the chance, because they were so sick. Some people had close calls at the hospital, and they wish they would have got the vaccine. I mean, most of them have gotten it now, but what they went through, they wish they would have gotten it earlier.
Yeah, it's miserable. And guys, we're here for you at Altus. Like I say, I mean, I've probably worked the most there, and I'm happy to see all of you. You know, you guys have ideas or see a study, run it by me. I mean, I try to keep up to date, and a lot of times it's hard to filter through, you know, a lot of the garbage that's out there, because medical journals are medical journals, but they don't come out every day, right? So you guys come across something that's new and novel, I'd love to take a look at it, or even just, you know, talk about it and see. Sometimes people send me an article, like I said, but it was a group study of 10 people. Yeah. You know, you can't study Lumberton alone for COVID. You know, you just can't, right? I mean, that works for that little community, but it's not the majority. It's not the masses of the world, right? We're all different. So I think it's. I have friends that won't get vaccine because they said there's. So, well, okay. Here's the deal with that. My father's 78 years old. If there's a problem 30 years from now, you know, I think I'm okay with him sticking around the 30 years to find out. Okay. And that's why I talked to you, Michelle, about my 13-year-old son. He's had it. He's antibody positive. I'm not in a rush to vaccinate him. He didn't have a problem the first time. He didn't have a problem. So I can understand the concern. I can understand the healthy 20-year-old. But I don't understand the 50-60-year-old worried about something that could happen 30, 40 years from now, because we got to get to 90 and 100. I mean, you know, it's not something, you know, that I think I'd welcome that at 90 or 100, getting through this, because most 60-year-olds are not going to get through it.
Right. Exactly. And speaking on this Delta variant real quick, Doc, I know you need to go real soon, but the Delta variant, I don't know if you've realized it, but this round, I don't think it was so much the first round of COVID, but with this Delta variant, it has even been affecting healthier people in their 30s and 40s. I don't know if you've seen that. Even younger people.
Absolutely. I mean, it doesn't discriminate. Okay. I mean, it's just because of how fast it replicates. That's why before it was more the comorbidities, right? Right. Now it's, you know, it's basically lowering as it gets better, right? It was the healthy 50-year-old. Now it's the healthy 40, 35-year-old. If it keeps up, it's going to be the healthy 25-year-old.
Right. Yeah. And I was talking to you earlier about a good friend we lost. She was 45 and here in Lumberton. She was the teacher that took care of Harper, my daughter, my youngest daughter, at the Mother's Day Out. 45. I mean, healthy. It's unbelievable. Even if you're healthy, it can affect you and put you on a ventilator. Oh, yeah. So you guys got to take care of yourself out there.
Absolutely.
So one last question here. He wants to know, how is the Delta variant being determined? I don't think you can tell if it's a
So
Delta
the
variant.
CDC does that. So whenever we take swabs, okay, we've done a good job with reporting. I mean, most hospitals, but specifically us. Every test that we do, whether it's positive or negative, we send the samples off, okay, and they get confirmed through what's called a PCR, polymerase chain reaction, right, where they're gene sequencing basically the COVID. And that's how they're determining, the Delta variant PCR versus the other one. The thing is, it's not perfect, right? Because
Right.
it's hard to retrospect a study with old swabs. It's almost happening now, right? So the data is always going to be delayed, right? Because you can't test from a month ago, right? Those samples per se, okay? They don't save all of them. I mean, it's like saving a billion samples. They just don't do that, right? So there's a shelf life of how long they keep them, they check them, they sequence them, and there is a database for it, but it's hard to do the previous study. I mean, not every CDC center is as big as the other one to be able to handle all the volume, right? So that's, the numbers are not going to be perfect with that, okay? That's the reality. They may not say it that way, but that's the truth, right? Not every Amazon warehouse shipping center is as big as the other one, right? So
Right.
they can only handle so much.
Right. So, Doc, before we get out of here, one message I want you to tell everybody that's watching, all of our viewers, what can they do? What can I do? What can you do as Americans? What can we do as our part to help slow the spread and stop this? What can we do? What advice would you give us?
Living a healthy lifestyle is always number one. Drink lots of water. If you're around somebody and you're worried, get tested quick. If you're an anti-vaxxer, get tested as soon as you can so you can start the treatment as soon as you can. If you're someone who really is an anti-vaxxer, take some time to come to Lumberton and talk to us. See if we can change your mind. I'd be happy to. Okay.
Free medical screening here, Dr. Goffey.
Yeah,
I'll give you free
I'm
medical.
happy to spend time with you. I'm happy to go over a study with you. I may not find a lot of time. I need you to be patient, of course, in the ER now because we are very busy. But I would love to talk with you guys. That's why I'm doing this today. Most of the time, the information you're getting is not a credible source. It's not, and therefore, reading real studies, right, and real recommendations is really the best preventive thing. Because I'm sure if you do that, you will run and get vaccinated. Because the reality is, forget the original study of 75,000. Look at the world, right? You're talking over 500 million people are in the study now that are not on paper for the Moderna, right? That the world has gotten it, right? How many people are coming online saying that, they got these obscure things? You're reading about the same 3 people, over 500 million. Mm-hmm. You're not reading about, millions of people with problems. They're sharing the same story of 1 or 2 people. It's not, what you think. It's not thousands of people with the same complications.
Right.
They're making it seem like it's that way, but it's not.
Right. Well, Doc, hey, thank you so much for spending an hour with us today on Doc Talk. I know a lot of people had a lot of COVID questions. Thank you so much for taking time out of your day to talk to us.
Be safe, everybody. Be healthy.
All right, Dr. Goffey. Hey, I'll see you in Lumberton later. Take care, buddy.
I'll be there tomorrow.
All right, man. All right, if you want to see Dr. Goffey, he'll be here tomorrow. Guys, thank you so much for tuning in to another episode, our second episode of Doc Talk. And remember, guys, we love you guys. We value your opinions, your freedom of choice. That is what we want you to know that we respect. We don't want you to ever think we try to push a fear agenda on you. We just like to give you the information that we have so you can make the best decision for your family. Hey, and a shout out to all the nurses, doctors, front desk staff, all the x-ray techs. I mean, everybody at the medical community. Thank you. I mean, you guys haven't given up. Like I said, you guys are relentless and we couldn't do it without you guys. And guys, if you do have to go to, Altus, urgent care, a doctor's office, please be patient. Right now, they're slammed. I mean, there's so much burden right now in the medical community because COVID is hitting us hard in every location, all the states, the U.S. I mean, it is a big ordeal. So just be patient, give them grace, just let them know you care, and just a simple thank you can make such a huge difference right now because they're so stressed. Trying to keep everybody safe in the community. But hey, guys, we're here 24/7 at your Altus locations. If you ever need anything, we're here. And like I said, we have that free medical screening. We're here to take care of you guys. We'll talk to you. We love you guys. We truly are invested in you, and we'll do whatever we can to take care of you guys. And remember, every other Wednesday, we'll be doing another Doc Talk episode. If you have any suggestions, any comments, please comment below. I'd love to talk to you. If you have any suggestions for our next topic, please let me know. It'll be every other Wednesday. So it won't be next week, but it'll be the next Wednesday. And due to complications, we had to do it today on a Thursday, but normally it will be on a Wednesday. So every other Wednesday. So not next week, but I'll see you next Wednesday. So you guys stay safe. Please be careful. Take care of your loved ones. It's bad out there. I want you guys to be safe. We love you guys, and we'll see you next time. This is Reagan signing out with Doc Talk. Thank you so much, guys.